Hello everyone. A very good evening to you all. Myself, Dr. Sumedha Gupta, and on behalf of Voice of Healthcare, I would like to welcome all the viewers who have joined us today. Today, we are here for an excited discussion on the topic Heroes Fight for Health, Join the Prostate Cancer Awareness, which is going to be a very insightful. And I would like to mention that this initiative is supported by Zydus Life. As of the latest data, if I would say, prostate cancer is one of the most common cancers among men in India. And according to WHO, prostate cancer accounts for approximately 11.6% of all the new cancers in Indian men, reflecting a significant increase in incidence over the recent years. The estimated numbers of these new cases is around 60,000 manually, and which is a noticeable rise in diagnosis, which actually is due to improved awareness and screening practices. However, despite these advancements in detection, the mortality rate remains a concern. And in light of these stats and facts, in this session, we are going to discuss about the holistic prostate cancer care by integrating physical, emotional, and psychological support. To begin with the discussion first, I would like you all to join me in welcoming our experts who are going to provide us with insightful information on understanding about the prostate cancer care and its awareness. I would like to welcome Dr. Ranjit Kumar Sahoo, Additional Professor, Department of Oncology, AIIMS, New Delhi. Good evening, Dr. Ranjit. Welcome to the panel discussion.
Hi, good evening.
Next, I would like to welcome Dr. Atul Batra, Additional Professor of Medical Oncology at AIIMS, New Delhi. Good evening, Doctor. Welcome to the panel discussion.
Good evening. Thank you for inviting.
Next, I would like to welcome Dr. Anup, Professor and Head of Department of Urology and Renal Transplant, Vardhman Mahavir Medical College and Safdarjung Hospital, New Delhi. Good evening, Doctor. Welcome to the panel discussion.
Good evening, everyone. Thank you very much for
Next,
inviting.
I Next, I would like to welcome Dr. Kaushal Kalra, Medical Oncologist, Vardhman Mahavir Medical College, New Delhi. He'll be joining us in few minutes. And Dr. K. Madan Gopal, Advisor and Head Public Health, Administration Advisor and Head Public Health Administration, National Health System Resource Center, Government of India. I would like to mention that Dr. Madan Gopal is not keeping well, so he might join us in some times. Let's delve into this insightful and informative discussion. Let's start with the question first to Dr. Ranjit Sahu. I would like you to, Doctor, please tell us about what are the specific elements should be included in a comprehensive prostate care plan to ensure it addresses all the physical, emotional, and psychological supports effectively.
I think the issue with this prostate cancer is because of its location, many of the men they actually do not know this organ. So that's why the early referrals, at least in this part of the world, it becomes very difficult. So the ailments that are pertaining to a malignancy or a tumor of prostate gland, it reflects in the urinary complaints. So if a patient has some, I mean, those who are older, and this is a cancer of older age group, and if a person who is in their 50s or 60s and having urinary issues like urgency, frequency of urination, or frequent infections, then they should consult a physician to get all the examinations, which starts from mm, normal urine evolution, an ultrasound, and physical examination where the prostate gland can be felt. So early referral to a physician, which could be just be a general physician, is essential to pick this cancer up. And most of this cancer, they can be picked up at a very localized state. And these things are very much curable if they are detected early.
Thank you, Dr. Sau, for highlighting the elements that we can integrate. Moving on to discussion, I would like to ask Dr. Atul Batra, can you please tell us what should be the best practice for caregivers to manage the emotional and physical demands of supporting an individual suffering from prostate cancer holistically?
See, prostate cancer can be diagnosed at different stages. So the physical demands would also depend at what stage is the patient diagnosed, what are the symptoms at presentation. Common symptoms that would be present physically include some urinary symptoms that would be present at early stage as well as the late stage, right? So there are some medications that can be given. There are certain procedures that can be done. So it generally requires a multidisciplinary team, especially if it's an advanced cancer. Early cancers are usually seen by urologists, and then late stage cancer, including metastatic disease or where we are giving hormone therapy plus radiotherapy. There are several components of treatment that come into picture to control the disease burden. And then there are in later stages, like commonly it spreads to bones and other organs. Bone is a very common site. So pain is a very common symptom that is present at presentation and advanced stages, which can usually be taken care. There have been several advances in the treatment of prostate cancer, and now we are seeing long-term survivors increasing with uh, so many treatment options that have become available. And emotional component, there are two parts to it. One, cancer itself, when it is diagnosed, it's a emotional issue for not just the patient but also for the complete family. It's a shocker. And then the treatment also includes suppression of testosterone, which is male hormone, which itself also leads to several emotional disturbances. So this has to be taken care of as a holistically in a multidisciplinary approach, and several times we also take help of our psychologist in handling these issues.
Thank you, Dr. Batra, for outlining the best practices for caregivers. And I think this guidance on managing both the emotional and physical demand you provided is so enlightening and should have to be incorporated practically. Moving ahead, I would like to ask Dr. Anup Gupta, can you please tell us like what are the key components of mental health support services that should be integrated into prostate cancer care, and how can these be implemented in practice?
So, as Dr. Atul Batra was highlighting, the moment you tell the patient and the relative that he has got prostate cancer, they have a shock, and the whole psychology changes. So, we have to not only manage the patient but also the attendant psychology, because the compliance is very important. And now we have different stages of cancers. The patient comes in early stage, then of course you have to describe the patient attendants the pros and cons of surgeries and radiation therapy. So most of the time I have seen patient attendants are very anxious. They talk about the side effects, they talk about the oncological outcomes, and these are very anxious moments for them. So I think right from the day we tell them that you have prostate cancer, and especially if they have advanced prostate cancer or metastatic prostate cancer, we in our hospital we have an integrated approach. We have a psychologist and a psychiatrist on board, and whenever I see the patient is very anxious, the attendants are very anxious. After my counseling, I send them to the my colleague, and they also give a psychology counseling and psychiatry counseling just to calm them down. And of course, this is not only the one day counseling. Uh, as they come for treatment, whether it's a surgery or it's radiation or it's a chemotherapy or hormonal treatment, they have to be reinforced, with these kind of sessions. So I think now prostate cancer is a multidisciplinary approach. There is no doubt about it. It involves a surgeon, like me. I'm a surgeon. I'm a oncologist, a medical oncologist, like our friends Dr. Atul and Dr. Sahoo. Then, of course, it also includes physicians because they take care of the comorbid conditions, and a dietitian, and of course, now a psychiatrist and psychologist. So, this multidisciplinary approach is very important if you want to holistically treat the patient. Treating the cancer is one thing, and treating the consequences and side effects and psychology of the patient is another thing. So, I think this is very important. And also, after surgery and radiation, patient develops incontinence, patient develops erectile dysfunction. That also affects their psychology. Their morale is down. They are feeling underconfident. That time also we need counseling from psychology and psychiatrist. So I think we need their help at different stages. And lastly, for metastatic prostate cancer, I think when we tell them your prognosis is already very poor, that's the day I think they go into depression. And therefore now we have to get the treatment for depression and also psychosis, hospital induced psychosis. So every time they come for chemotherapy, every time they come for hormonal injections, they 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 face the same thing, and they undergo the same kind of emotions. So I think these patients are more vulnerable, and I focus more on these patients and their attendants.
Thank you, Dr. Gupta, for highlighting the essential components of mental health support in prostate cancer. And I think these insights on integrating and practical implementation you provided are very enlightening. And to support the care, one should opt all of this. So, moving ahead, Dr. Ranjit Sahoo, can you please tell us like how can educational programs be designed to improve prostate cancer patients and understanding of their conditions and treatment options?
So, as of today, in India, we do not have any screening program for prostate cancers. But awareness about this urinary symptoms due to prostate cancer or the tumor of prostate, it can have a massive impact. Now, people who are older, in their 50s, 60s, and 70s, if they have this urinary complaints, they should consult a physician. That is the bare minimum. So, awareness programs in this part of the country, they could mean quite a bit to pick up these patients at a very localized state. So, if these complaints have been taken care of initially, these patients could be present at a very early stage of their cancer. And when this cancer is present at a very early stage, they are potentially curable to a very high extent, let's say to an extent of 80 to 80 to 90% state. Now, when these symptoms are not been taken care of for a very long time, and these symptoms could be trivial, and the disease manifests at an advanced stage, they can still be controlled for many years, but they are not very much curable as they are. I mean, if they are detected at a very early stage. So awareness campaigns having, I mean, all these issues, and um, especially when the person cannot feel anything like a tumor. Normally, many of these cancers they present as tumors. Here, the patient cannot feel a tumor unless he reports to a physician who can definitely, I mean, if he examines properly, then he can feel that tumor. And investigations like an ultrasound, if they can be done properly, it can detect this tumor at a very early stage. So awareness about these organs, because nobody talks about the prostate organ, and this is not clinically palpable. I mean, no one. I mean, many of us we don't know about this prostate organ because that is not been discussed quite a bit. So I think if we take care of the symptoms properly, because men they usually do not get these urinary symptoms that frequently. If they have these urinary symptoms at a later age, like 60s, 70s, and they consult a physician, then they can definitely be picked up at a very early stage. That is very key.
So, thank you, Dr. Sahu, for such insights on designing awareness programs for prostate cancer patients. And I think these recommendations for improving understanding and treatment awareness are practically very valuable and should be opted. Moving ahead to Dr. Atul Batra, I would like you to ask to tell us in what ways can family and friends enhance the support network for prostate cancer patients, and what specific roles should they play in the care process?
See, any cancer as such is a disease for the patient as well as the family. The treatments are usually very long lasting. There are so many issues because of the disease, because of the treatment, the financial constraints, the emotional issues, the social issues. So, good social support with family as well as friends does play an extremely important role while managing such patients. Right? This is not a treatment like the patient comes to the hospital once, takes some medications, and then goes back and he's cured. Right? Even in the early stages, when the patient is treated with surgery or radiotherapy, there are symptoms that keep lingering on, and these patients do require, even after cure, long term social support with the family and friends for sure. And even for advanced diseases, there are lots of treatment related side effects. The usually they tolerate well, but still there are some adverse events. There are changes in the quality of life. There are so many other issues that need to be dealt with the family as well as friends. So I think they do play an extremely important role in kind of motivating the patient, having that motivation to complete all the treatment that is needed, and yeah, so they do play an extremely important role.
Thank you, Dr. Batra, for highlighting the important roles of family and friends in support of prostate cancer patient. And moving ahead, I would like to ask Dr. Anup Gupta, can you please tell us how can research findings on prostate cancer be translated into accessible and affordable treatments for the patient across different economic backgrounds?
So I think for a country like India, the cost of treatment is a very important factor. We talk about various treatment options, whether it's a robotic surgery or it's a radiation treatment, chemotherapy, hormonal treatment, second line, third line drugs, all are very costly. And I think we do need more research and we need more cost effective treatment. Now, when I talk about cost effective treatment, of course, one option is that we can make the surgical treatment more cost effective in different ways. The government is providing subsidized treatment. Similarly, the more number of robots we have across the country, the cost of treatment will go down. Now, when we talk about basic research, I feel there- there's a group of patients, they become refractory to surgical treatment or radiation treatment as a primary therapy. Then we offer them chemotherapy, and chemotherapy right now is not a very costly treatment. Problem arises when they become refractory to chemotherapy, and I think that's what I think feel that if we do more research and we can have a more cheaper and cost effective options available. Right now, you name any drug and cost is going up. Although if I talk about last one decade, the treatment has cost has come down for many hormonal treatment drugs, but still some of the drugs are costing 2 to 3 lakhs per cycle. So I think one, we need a basic research for more molecules, and especially if we can produce in India, because all the drugs we are right now are importing from outside India, whether it's Europe or USA. Although some of the hormonal treatment now we are also making in India, and that's how the cost is coming down. And of course, they talk about tumor vaccine going on for last almost now 10 years, and we still are in phase one trial. I don't think that tumor vaccine is going to come in next 5 or 6 years, but I think this is something if we can achieve that. And just for the listeners, I can tell the tumor vaccine is basically we want to change the balance between the oncogenes and the tumor suppressor genes, and then we can actually prevent the cancer at the basic cell level. And I think if we can achieve that, and we can produce make in India vaccines like we did for COVID, I think that's something we are looking forward for next 1 decade or so. But I think that surely can happen. It's not an impossible task. Only thing we have to keep doing good quality research. Thank
Thank you, Dr. Gupta, for addressing how research can lead to accessible and affordable treatments. And the insights which you have provided, like Make in India vaccines, are indeed very valuable practically for bridging the gap between advancement and patient care. Moving ahead to Dr. Ranjit Sahoo, I would like to ask what are some common myths about prostate cancer that hinder effective patient care and how they can be debunked?
So there are many common myths about overall cancer. I mean, if a person is diagnosed with prostate cancer, the first myth is it is incurable. So it is not incurable, it is potentially curable in most of the patients. Now, the second myth is if it presents at an advanced stage, it is incurable. No, that is also not true. Close to 20% of these patients, they can have long-term disease-free states. They are potentially cured. Now, the third myth is the treatment is very, very expensive. The treatment is not expensive. Especially in a government sector, the radiation therapy or surgery, they are not very expensive in patients who have localized prostate cancer. Now, the fourth thing is the hormonal therapies are very expensive. Hormonal therapies are not very expensive. If we can remove the testes of the person, then removal of testes is not very expensive. And in a government sector like ours, they do not go beyond 1,000 rupees. And it is an outpatient procedure. It doesn't have many long-term side effects. It is a very easy thing. And this is a permanent thing, so we don't require any extra hormonal therapy beyond this. The other hormonal therapies, there are many drugs which are given in addition to removal of testis or castration. They are all available in our country, and there are a lot of generics which have been made. Now, if I make quote of one such drug which is very commonly used in first line when these patients are presenting at very advanced stages, called as abiraterone acetate. Now, this drug, a monthly cost is close to 5,000. But at the same time, if this drug, if we take the dose is actually 4 tablets a day, but even a single tablet a day, when it is taken with specific food, this is as good as taking 4 tablets a day. So the overall cost of a patient when they are treated in first line with abiraterone, it comes to near about 1,000 rupees a month. So the treatment is not very costly, be it government, be it private. But the economic things, it should be discussed upfront by both the patient and the doctors. There should be a clear-cut discussion about the economics that the patient has. And if the patient is short on economics, it can still be managed very, very diligently. Thank you.
Thank you, Dr. Sahu, for addressing these myths. And it's essential to challenge these misconceptions to improve patient care and outcomes. And moving ahead, I would like to ask Dr. Atul Batra, can you please provide us with like some insights on that? What are some of the emerging trends and supports are present in prostate cancer treatment, and what should be incorporated that definitely can transform patient care in near future? Dr. Atul Batra, you are on mute. Yeah, you're
So if
audible.
we see what all treatment changes have happened, a lot has happened actually in the treatment space in prostate cancer, especially if we talk about advanced stage prostate cancer. There has been a lot of studies, lot of research that has happened over last decade or so. We have seen emergence of several new drugs, and including the one previously mentioned like abiraterone, enzalutamide, Cabazitaxel. Now, earlier we thought that these drugs could be given later on after the failure of what we call as androgen deprivation therapy, which could either be by medical ways or by surgically removing the testes. Now, what recently has been shown in large clinical trials that as we treat these patients, bringing these agents into the frontline setting has shown good uh, increase in the outcomes of, if we talk about number of years as an average survival of such patients, these have increased, be it any agent like chemotherapy with docetaxel or abiraterone or enzalutamide. And of late, there have been studies where combining and giving more aggressive treatment at the baseline at an advanced disease also improves the outcome a lot. So this is considered to be the most modern therapy now, where you give kind of the most aggressive therapy with chemotherapy with some novel anti-androgen, what we call as well as doing ADT. This has been shown to improve survival. A lot of questions have also been posed around that. That who is the best patient to get such kind of treatment, whether that is a younger patient, whether that is an old patient with higher disease burden. There are several things that we need to discuss in a multidisciplinary team with a urologist, with a radiation oncologist, or how to integrate the best. So there are several, these agents have to be used one by one, and what is the best sequence, that has to be discussed in a team with all important stakeholders. You know, none of the I think the best management happens when we have everyone in the managing team, including a pain a physician, including, because these are all the events that would eventually happen with patients and can happen at any point of time. So, including everyone and making sure that the patient is treated as a patient, as it's not treated as a disease, becomes the most important thing while treating such patients.
Thank you, Dr. Batra, for sharing these insightful developments. And it's actually very encouraging to see how emerging trends could significantly enhance patient cares and outcomes. And definitely, these insights will help us to stay informed about the future of prostate cancer treatment and support. I would like to welcome Dr. Kaushal Kalra. Good evening, doctor. Welcome to the discussion.
Yeah, hi, thanks. Sorry, I'm late.
No worries, doctor. So, moving ahead with the discussion, I would like to ask Dr. Anup Gupta what recent advancements in the technology or treatment are making a significant impact on the holistic care of prostate cancer patients.
So I think the treatment of prostate cancer, which what we saw 2 decades back, it has changed dramatically in favor of better outcomes. Uh, First of all, if we talk about surgical treatment, I think we used to do open surgery for prostate cancer, and then we used to go for laparoscopic radical prostatectomy. But the outcomes were not as good as we expect, and patient used to have uh, incontinence for a long time. Recovery was very long, and also erectile dysfunction was there. And then with the introduction of robotics in 2004 in India, that was the first robot introduced in the already understood when I was doing the residency in AIIMS. And since then, now it is almost 20 years. And now the development has taken place across country. We have now more than 150 robots, although still not enough to serve a population of 1.3 billion, but still I can say it has really served a lot of patients. So this is, I think, one advancement which has changed dramatically the outcomes, whether it is functional outcome, the continence part, erectile dysfunction part. The recovery is very fast. Blood loss is almost very minimal. Pain is a very minimal, and patient overall recovery time has reduced to almost a week. So this is something in surgical treatment. Now we talk about radiation treatment also. Now they have advanced machines which are available for radiation. Earlier they used to do radiation. It used to affect the surrounding organs with a lot of side effects. But now I think it is very targeted and focused treatment using IMRTs and other kind of high machines for radiation. The side effects have decreased tremendously, and it is, I think, very beneficial for the patients. And then, of course, we talk about the availability of drugs, which my colleagues were telling. There are a lot of changes now. What we had earlier, and now we have whole gamut of drugs available. First line, second line, third line, even fourth line is available. And also we have now the role of genetic testing, in these patients, which was not there, I think, a decade before. Now, for all the patients who come to us, we go for genetic testing at the level of diagnosis, first level, and then we keep on repeating it as the patient progresses. So, I think this is the fourth latest advancement which has happened in genetic therapy and treatment based on genetic therapy. And fifth, I think, which is very important, is the concept of multidisciplinary approach. Everybody has realized not a single doctor or a single department can treat this patient. We have to involve all the departments, and I think that's a very welcome move. Our colleagues from different departments, we have a very cordial relations, and we treat the patient as a whole, as a team, not as an individual department. And I think that also helps the patient in different situations. So I think these are latest developments, which I told you, 5 more major developments. The concept of tumor board, concept of multidisciplinary approach has come across along the major leading oncology centers. And I think this is giving good results to our patients. Thank you.
Thank you, Dr. Gupta, for detailing these advancements. And I think it's clear that technology is playing a transforming role in the holistic care of prostate cancer patient. And these insights are definitely highlighting the exciting possibilities for improving both treatment and patient care experience. So I would like to ask Dr. Kaushal Kalra if you can provide us with some insights, like what are some of the examples of disparities in prostate cancer care across different communities, and what targeted interventions can help bridge these gaps?
The disparities in the prostate cancer care often manifest along the racial, socio-economical, and geographical lines. For example, in Western country, black men faces higher rate of prostate cancer incidence and mortality compared to the white. Socioeconomic factor can impact access to the care with lower income individuals experiencing barriers such as the lack of insurance and limited access to the healthcare facility. Rural community may also face the difficulties due to fewer specialized treatment cancer and healthcare resources. To address these disparities, several interventions can be effective, like community education, outreach, and training the healthcare provider in the rural area for the proper competence, proper screening, proper treatment of the patient of the prostate cancer. And support program, developing support programs such as patient navigator or community health worker can help guide individuals through the healthcare system, assist with appointment scheduling, and provide emotional support.
Thank you, Dr. Kalra, for highlighting these critical disparities, and these examples which you provide underscores the need for target interventions. And it's clear that tailored strategy will be the key in addressing these gaps and for improving the care. So, we have some questions on patient advocacies and policies. I would request any of the panelists to provide me with some details onto that. Can you please brief us about what role do the patient advocacy organization play in shaping policies and practices for prostate cancer care, and how can their impact be maximized?
So you want anyone? You want anyone can come in.
Yeah, yeah.
So patient advocacy organizations are they are playing a major role now. We talk about countries like America and Europe. They are very prominent there. A lot of NGOs and these advocacy organizations are working as a bridge between the healthcare providers and the patients. So I think in India also we have some of the agencies that have come up now recently, and they're helping us. In one is of course to make the patient aware what is happening to him, because sometimes in such a busy schedule the healthcare providers are not able to explain to the patient properly. That what is happening, what is going to happen next. So these agencies they provide them good counseling. What is going to happen to them. Number one. Number two, they also provide them some financial supports, especially to our underprivileged, because like our colleagues are telling, in government a hospital like us, we do provide them free of cost, but that is not the scenario for our 80% healthcare providers in private practice. They have to pay from their own pocket. So I think there they also provide them some kind of financial support under CSR activity, and of course
Yes.
they also help them in other things like uh, sometimes they are very old, they don't have any relatives to take care of them. So these also provide them at home service providers help the support to them at home, which can take care of their daily activities as well as to take them to hospitals. These are some things I think I've seen over the last few years. These NCs have come up, and I think we should promote them because their basic interest is to just help the patients. So as long as the interest is very genuine and very noble, we should always support them. Thank
Thank you, Dr. Anup, for emphasizing the crucial role of patient advocacy organization and the points that you provided, which highlight how their involvement can drive meaningful changes in the policies and practice, are very insightful, and one should opt them for to maximize the impact in advancing prostate cancer care. So, next, I would like to ask Dr. Kaushal Kalra if you can provide with some insights on what psychological challenges do prostate cancer patients frequently face, and what approaches are most effective in providing mental health support.
Yeah, that is very important question. Then psychological challenges, like first is the fear and anxiety. In every patient, they have concern about the cancer progression, treatment side effect, and impact of the life expectancy can lead to significant anxiety, which cause the patient, many of the patients are depression, they are feeling of sadness, hopelessness. Second is body image and sexual issue. Treatment and disease also can affect the sexual function and body image, impacting self-esteem and relationships. Next is the uncertainty and the stress. The unpredictability of the cancer progression and treatment outcome can cause ongoing stress. So, effective mental support approach is needed to holistic treatment of the patient, like counseling and psychotherapy. Individual or group therapy can help the patient process their emotions, developing coping strategies, and address the specific concern related to their condition. Support groups should be provided to connecting the with others who have similar experience, which can provide the emotional support, practical advices, and sense of the community. Next is the education and the information, providing patient with clear information about their diagnosis, treatment option, which can reduce the uncertainty and anxiety. Next is the medication for the some patient, anti-depression or anti-anxiety medication may be necessary to manage the symptom of the depression and anxiety.
Thank you, Dr. Kalra, for outlining the psychological challenges faced by prostate cancer patient and providing the effective approach for mental health support and one should definitely incorporate. So next I would like to ask Dr. Atul Batra to provide us with some briefing on that, like how can public health initiative can more effectively address the stigma and misinformation surrounding prostate cancer.
Public awareness plays a very crucial role. One, if such cancers are diagnosed at early stage, they are curable to a large extent. While if we see if they are neglected at early stage and then diagnosed at an advanced stage, then even though they are treatable, but cure is possible only of in few of them. Right? It is not completely curable. Although with all the medications that are coming up, the treatment landscape has improved drastically, and we are seeing long-term survivors with all the medications as well as testing that is available based on which several targeted therapies are also being used. So, knowing that prostate cancer is a common cancer in men, especially in patients who are over 50, 60 years of age, and common symptoms, knowing about what are the common symptoms, predominantly urinary symptoms that men face, and several times these are being neglected, uh, which are not, the patients do not come forward considering that this is probably a part of aging. So meeting a urologist, especially if you're in cities, meeting a urologist does make a lot of sense. Going to the right specialist at an early stage, if not possible in cities, in towns or villages, meeting a physician who are also made aware that prostate cancer is increasing, and then just knowing that such a disease exists does make a lot of difference in the public as well as in the healthcare system.
Thank you, Dr. Batra, for addressing these critical issues of stigma and misinformation. And indeed, these suggestions on enhancing public health initiatives are actually very valuable and enlightening. Moving ahead to Dr. Kaushal Kalra, I would like you to please tell us how do multidisciplinary teams can coordinate to provide care for prostate cancer patients, and what benefit does these collaborations bring to patient outcomes, and how we can enhance that?
Yeah, multidisciplinary approach is the mandatory for not only prostate cancer, for the every type of cancer. There's a team is there for the prostate cancer. The team composition should be medical oncologist, radiation oncologist, urologist, radiologist, and definitely this thing nursing team. Medical oncologist oversees the oral treatment plan and chemotherapy for the prostate cancer, metastatic prostate cancer. Urologist, the patient is of the in the localized condition, localized disease, then he is specialized in the surgical intervention and urological issue like difficulty in micturition, poor stream, blood in urine. So urologist will see. Radiologist plays the important role in the diagnosis and staging, like manage the imaging and diagnostic process. Like for the diagnosis of the prostate cancer, transrectal ultrasound is mandatory, is needed for the prostate biopsy. So radiologist and MRI PSMA PET scan, these type of the intervention needed for the complete staging of the prostate cancer. And radiation oncology is also very plays important role in the localized disease where surgery is not possible for the definitive radiotherapy, radiation therapy. And in metastatic setting like bone metastasis, they play in the palliative radiation is also play an important role. Then nursing officers, they provide the care and support throughout the treatment, and along with these, like mental health professional for the address the psychosocial and emotional needs, dietitian for offering the dietary advice and support. So team management and this thing, tumor board meetings, these should be held for the and these are going on for the completely treatment plan at the starting of the treatment.
So, thank you, Dr. Kalra, for detailing and enlightening with various methods and strategies that how multidisciplinary teams can enhance prostate cancer care. And indeed, this is the right approach and should actually be opted to provide the resultant care. Moving ahead, I would like to ask Dr. Anup to provide us with some insights on how can healthcare systems better integrate policies that promote equitable access to prostate cancer diagnosis and treatment for all the demographics.
So again, this is a very important question because majority of our diagnostic and treatments specialties, they are more concentrated in tier one and tier two cities. We talk about tier three, we talk about rural areas. I think we have really very poor services over there, and our patient they have to travel many kilometers just to have access to these services. And I think that's why our government of India they started this program to upgrade very state level and district level hospitals to state of art super specialty hospitals, including the oncology centers. And this is going on for last many years. I have seen myself, I have visited myself many of these centers, and they earlier were not providing any of this specialized, like we talk about multidisciplinary team. They don't have even a doctors pertaining to those disciplinary teams. How can they provide the treatment? But now, after building those state-of-art buildings and recruitment of doctors, they are giving very good services to these patients. So I think that policy has been already imbibed by our government of India, Ministry of Health, and they're trying to upgrade under PM Yojana. There are many centers have been upgraded across the country. So this is number one. Number two, of course, as our government of India, they're trying to decrease the cost of whether it's disposables or the medicines used in cancers, and that's why we know about uh, the PM Janaushadhi Kendra, where they provide you chemotherapy drugs at almost one fourth of the cost. So I think this is something is going on across the country, not only in tier one, tier two, but across the country they are providing that. And of course, number three policy which I can see is the role of CSR funds, especially for oncology. And this is happening now. The CSR funds are being allocated to rural areas and suburban areas, tier three cities, where they can upgrade the centers into a good oncology center. And that includes not only treatment but diagnosis also. If you need a simple ultrasound, many centers do not have ultrasound. You forget about MRI, you forget about PSMA PET scan, you forget about biopsies being done by trusts. And now we talk about MRI fusion biopsy. These are very high tech techniques. But now with the use of CSR funds, I think I'm very hopeful next 5-6 years we'll have good quality diagnostic centers and treatment centers across the country. But of course, the government of India need help from the CSR funds in this project.
Thank you, Dr. Anup, for that insightful response. And it's clear that addressing these disparities require a multifaceted approach. And I appreciate your emphasis on implementing various strategies that will undoubtedly will enlightening and ensuring to provide a patient care. So, in the end, to conclude this discussion, I would request you all one by one to provide with some conclusive points or results in terms of providing awareness to the patient if you want to deliver some. So, I would like to request Dr. Atul Batra to start with this first.
To conclude, I would say that prostate cancer is common. It is increasing as the years are passing by. It is curable, definitely curable at early stages and treatable even at advanced stages with several patients living for years altogether. Reach out to the right specialist. I think if you have certain symptoms that suggest there could be suspicion for prostate cancer and get treated early for the disease rather than waiting for the same. Thank you.
Thank you, Dr. Batra. I would request Dr. Anup to provide with some points.
So finally, I want to emphasize on the concept of smart screening. In India, we don't have any screening protocol, but what do you mean by smart screening? I will advise that only any patient more than 50 years who has got urinary symptoms should have annual checkup for prostate-specific antigen. It's a blood test really available in government centers and in the private center also very cheap test. That is number one. And a patient should undergo a digital rectal examination by a urologist just to rule out cancer. So this is a screening protocol, very simple, very easy, and that should be done annually after 50 years. Number two, if you have a family history of prostate cancer, your risk of prostate cancer increases by 9 times. And those families, the screening should start from 40 years onwards. So this is the first message I want to give. And of course, second is, as my colleague said, early diagnosis treatment is the key. And therefore, if you go for the screening protocol, your treatment will be at the early stage. And how can you prevent or you can prevent the progression of disease? I can say you should exercise 30 minutes a day, avoid alcohol, tobacco, avoid overweight, take fresh food, avoid junk food, and take a lot of fluids. These are general instructions we give for any cancer patients, and if you follow that, you might prevent progression of disease. Thank you.
Thank you, Dr. Anup, for such insightful instructions. I would request Dr. Kaushal Kalra to provide us with some insights onto this.
Yeah, most of the points have been said by Dr. Atul Batra and Dr. Anup. So, in conclusion, addressing prostate cancer effectively requires a comprehensive approach that includes increasing awareness, debunking myths, and ensuring equitable access to the care. Accurate information about the prostate cancer, its risk, and treatment option is crucial for the patient to make an informed decision and for the reducing stigma. Healthcare system must focus on eliminating disparities by providing universal access to screening, treatment, and support services tailored to needs of the diverse population. By improving education, encouraging open dialogue, and advocating for policy change, we can improve the outcome and quality of life for those affected by the prostate cancer.
Thank you, Dr. Kaushal, for such insightful instructions. So, in the end, I would like to mention that our aim for this panel discussion today was to understand, address, and highlight the holistic prostate cancer care by integrating physical, emotional, and psychological support. And I'm definitely sure that this actually has been addressed very wonderfully by our experts, and that too in a very appropriate, informative manner that one layman can understand it from A to Z. So I would like to thank you all the panelists for such an insightful discussion. Thank you so much, everyone.
Thank you. Thank you.
Thank you.